Autumn is here, and with it comes the chill that heralds not just cozy sweaters and pumpkin lattes, but also the looming specter of respiratory illnesses like COVID-19, influenza, and RSV sweeping across the nation. It's a season that tests our health defenses, but the good news? Vaccines are stepping up as key players in the fight. Yet, as many of us ponder whether these shots really deliver the protection we crave, questions linger about their true impact, especially when we've heard stories of people getting sick despite being vaccinated. Dive in with me as we unpack what experts are saying about this year's vaccinations and discover why they might just be. The U.S. Centers for Disease Control and Prevention, CDC, predicts that the upcoming 2025-26 fall and winter respiratory season will mirror last year's in terms of peak hospitalizations from COVID-19, the flu, and RSV. That means we're looking at similar challenges, but proactive steps can significantly lower your chances of severe illness. And vaccination? It's front and center in that strategy. I often hear from my patients something along these lines. Dr. Wren, I got the flu vaccine last year or the COVID shot, but I still caught a virus. What's the deal? Shares Dr. Mike Wren, an assistant professor of family and community medicine at Baylor College of Medicine. His response? Vaccines aren't foolproof barriers against catching an illness altogether. Think of them more like a strong suit of armor. If you're exposed directly, say through a sneeze from someone infected, you might still get a mild version of the bug. But the real power lies in preventing the severe outcomes that could land you in the hospital or worse. Each year, flu and COVID claim significant lives across the country, underscoring why these shots are vital. For instance, imagine the flu as a storm. Vaccination doesn't stop the rain, but it keeps the flood from devastating your home. To put numbers to this, the CDC estimates around 1 million hospitalizations and up to 130,000 deaths from the flu during last season, from October 2024 through May 2025, based on preliminary data. For COVID-19, the figures are equally sobering. Nearly 540,000 hospitalizations and up to 63,000 deaths from October 2024 to September 2025. These stats highlight the stakes and why vaccines are worth prioritizing. Now, let's get into the nitty-gritty of what you need to know about getting vaccinated against COVID-19, flu, and RSV this year. And this is the part most people miss. The recommendations have shifted a bit, emphasizing personalized choices rather than a one-size-fits-all push. For COVID-19, the CDC advises that individuals aged 6 months and up, including expectant parents, should chat with a healthcare professional about receiving an updated vaccine this season. This marks a change from previous years' broader encouragement for most people to get a booster. This year, the federal government hasn't issued a blanket recommendation for the COVID-19 vaccine, explains Dr. Dan Barosh, director of the Center for Virology and Vaccine Research at Beth Israel Deaconess Medical Center. Instead, it's available to everyone 6 months and older through a shared decision-making process where you discuss the pros and cons with your provider. Healthcare providers could include doctors, nurse practitioners, pharmacists, or physician assistants. In the U.S., 3 COVID-19 vaccines are on offer. Pfizer for those 5 and up, Moderna for 6 months and older, and Novavax for 12 and above. Pfizer and Moderna rely on mRNA tech, which teaches your body to recognize and fight the virus, while Novavax is a protein-based option for a more traditional approach. These updated shots target the latest circulating strains of the coronavirus and are widely available at pharmacies, doctors' offices, and public health departments. Dr. Panagis Galiotsatos, a pulmonary and critical care physician at Johns Hopkins and spokesperson for the American Lung Association, notes, places like Walgreens or CVS typically stock them. Before the CDC finalized its new guidance, access varied by state due to evolving federal policies. For example, CVS recently announced it's updating its systems to offer the updated COVID-19 vaccines nationwide without requiring prescriptions from outside providers. If you're wondering where to find these vaccines locally or how to vaccinate kids, Galiotsatos suggests reaching out to your city or county health department or a nearby academic medical center. He recommends getting the fall-issued update as soon as it's out, then consulting your doctor about a potential booster in about 6 months. Dr. Sarah DuPont, a family medicine physician at Emory Healthcare and assistant professor at Emory University School of Medicine, advises aiming for October or early November. Get it at least a few weeks before Thanksgiving to ensure protection during the holidays, she says via email. But if you've recently had COVID, hold off. Your immunity is already boosted. Insurance often covers these for eligible recipients, but without it, a COVID booster at a pharmacy might run about $220. The American Health Insurance Plans, AHIP, representing insurers for over 200 million Americans, states that its members will continue covering CDC-recommended immunizations, including this updated COVID shot, at no extra cost to policyholders through 2026. A recent study in the New England Journal of Medicine on last year's vaccines showed they were around 39% effective against COVID hospitalizations and 64% against deaths among U.S. veterans. These vaccines excel at warding off severe disease rather than mild infections, Baraj adds. So those at higher risk, think older adults or those with health conditions, gain the most. Can you combine a COVID vaccine with a flu shot? Absolutely, if that's your preference. No strict rules against it, just personal choice, Wren says. Some might experience more fatigue from multiple shots, so space them out if needed. For beginners, think of it like doubling up on workouts. Great for fitness, but listen to your body to avoid overdoing it. Shifting to the flu, the CDC urges everyone 6 months and older to get vaccinated annually. Guidelines haven't changed much from past years, Barauch confirms. Most need just 1 dose, but first-time vaccinated kids might require 2, 4 weeks apart. Effectiveness varies. Last season's vaccine was 42% to 56% effective in adults, per CDC estimates. Flu evolves seasonally, so we tweak the vaccine yearly, Galiotsatos explains. He suggests getting it at least 2 weeks before Thanksgiving to build immunity, as flu peaks from November through March. The CDC says September and October are prime times, ideally by October's end. Go for it now if you haven't, Galiotsatos urges. Public health campaigns like Flu Before Boo encourage shots by Halloween to keep things festive and protected. It's still beneficial later, but better before holidays to shield loved ones, DuPont notes. Flu shots are accessible at pharmacies, offices, or health departments. And here's a game changer. For the first time, some Americans can order AstraZeneca's Flu Mist nasal spray for home delivery in 34 states. Approved for self-administration in adults under 50 or with caregiver help for kids 2 and up, it's been around since 2003, but newly available for at-home use after FDA approval last September. Most insurances cover it, with an $8.99 shipping fee after a brief online screening. With that insurance, flu shots range from $30 for standard doses to $130 for high-dose versions, ideal for those 65 plus, DuPont says. For RSV, the CDC recommends vaccination for adults 75 plus and those 50 to 74 at higher risk of severe illness. 1 dose offers at least 2 years of protection. Additionally, Pregnant women between 32 and 36 weeks can get it to pass antibodies to newborns, or babies can receive antibody shots post-birth. If you're expecting in that window, consider it. It's like gifting your baby a protective hug against RSV, Galitsatos says. The vaccine is available year-round for adults, but best timed late summer or early fall. For moms, September through January, and for infants, October through March. Start now. It's a single shot, DuPont advises. Insured folks should see coverage. Uninsured, it might cost $350, but assistance programs can reduce that. Beyond respiratory viruses, don't overlook pneumococcal vaccines for pneumonia protection in older adults, infants, and those with certain conditions. Experts like Baruch cover coughs, get ample rest, eat nutrient-rich foods like colorful veggies, or try a multivitamin to bolster immunity. Simple habits that add up. But here's where it gets controversial. While vaccines are hailed as lifesavers, some debate whether the CDC's shift to shared decision-making for COVID shots dilutes urgency, potentially leaving vulnerable people unprotected. Others question the high cost for uninsured folks or the varying effectiveness rates. 42% to 56% for flu sounds decent, but is it enough? And what about the nasal spray for flu? A convenient at-home option, or risky self-administration that could miss professional oversight? These points spark heated discussions. For instance, should governments mandate seasonal vaccines more broadly, or is personal choice king? Do the benefits of combined shots outweigh the fatigue, or should we pace them out? I invite you to weigh in. What's your take on vaccine strategies this season? Do you see them as essential armor or overrated safeguards? Share your thoughts in the comments below. Let's keep the conversation going.